Howdy, folks. Welcome to episode 15 of Great Ideas with Great Minds. Today, we're going to talk about the future of healthcare and health insurance, and actually overall insurance, by looking at a tracking that will enable better rates, lower premiums, and increase overall satisfaction with insurance. Now, if those are three things you thought you'd never hear together, well, keep listening, because I think it's possible. Now, right now, unless you've been living under a rock, you know that healthcare and insurance as it stands is a pretty costly and pretty frustrating venture. And if you want to know more about insurance, part of the reason why is because insurance does not rely on person to person. It relies on a pool. Hence the reason that in order to have lower premiums, you need more healthy people to cover the cost of people who are actually needing the payouts for insurance. And so I've always thought about this, and I've been like, why are there less benefits for being a healthy person that's helping the pool? Because we all know that at some point we're going to be the person that's needing to have a payout because we're going to get injured, we're going to need disabilities, something like that, that will make us having to pay more, and which will in turn usually raise our insurance. But while we're healthy and blessed, why aren't we doing more to pay less? And the way that I think we get this done, and in turn help the pool be better, is to have something that rewards healthy behavior. Now, just a heads up, this is about to reek of a little bit of the Big Brother. So if you're uncomfortable with that, I appreciate that. But what if we go beyond those devices in cars that can monitor our miles and our driving habits to going on the person, and not even just being with your smartwatches, but going beyond that, to where we have our constant heart rate. We have a constant analysis of what exercise you're doing. We have a constant analysis of caloric intake. We have a constant analysis of what you're actually eating. An analysis of stress. An analysis of healthy habits. How much you smoke, how much you drink, how much you do drugs. Now, I know some of that can be a little bit controversial, but none of this is being used for the government. It's being used to go back and say to your insurance company, hey, this person's making a lot of good choices. And since they're not going to be doing these things that, for example, get them injured as much or have them get high blood pressure later in life, maybe we reward them by giving them lower premiums. Because if they're actually helping us, they're lowering the overall cost. And this is when it starts getting really cool. Because although insurance is more than individual, if individuals begin to make better choices, it helps the pool in total. Because all of a sudden, if individuals stop costing more on average, then the payouts decrease. Because it's less necessary to have these drastic procedures like heart failure or any of these things that aren't always caused by having poor nutrition or lack of exercise, but oftentimes can be addressed by such things. And so not only is that making a healthier society, but it's also helping us pay less. And so for these companies, that means their bottom dollar is being less threatened because they're not always having to do the most expensive payout to help people. And so usually the way that we refer to that is, are you being proactive or reactive? So currently we have a system that is more reactive than proactive. And when I say that, what I mean is we are working for when things go bad and then we pay out. Instead of encouraging people to be proactive, aka not taking the risks or having unhealthy behaviors that lead to a less healthy lifestyle, which in turn lead to the need for costly procedures. Let's look at how you go to your dentist. Okay, so your yearly checkup at a dentist is a certain price, but that price is much lower than, let's say, a costly root canal, or when you have to have all your teeth replaced, or when you have a cap lost. And so usually, unless there's extenuating circumstances, by having healthy habits like brushing your teeth every day, or making sure that you cut down on how much sugar you intake, and by flossing, you're able to prevent yourself from having those costly surgeries, which in turn allow you to have lower dental, and in turn make it less burdensome on your company's insurance or your local insurance, whichever one you're using for health. And so now we extrapolate that to everything. So when you're reaching your 80s, 70s, and you've lived a healthy lifestyle, and we have less people having these heart attacks, and we have less people in need of wheelchairs, we have less people in need of gastric bypass or other costly surgeries, we finally reach a point where the people who actually need help, we have the resources to help them. So we're not blaming people for being unhealthy or having trouble come up. In fact, we have so much resources prepared by that point that we're able to help them fully. But since relying on the majority of our pool being healthy then and making good habits, it's also meaning that everyone's paying less. And that's pretty cool because all of a sudden we go from being the highest cost of healthcare in the world to actually being manageable. In order to tweak this, it might have to go a little bit more national and to be a more standardized system of healthcare to account for this. And it would also need a little bit of an advancement for like tracking so that you can have all this intake of your fitness and of your heart rate and what you eat, what your habits are. We're already halfway there. I mean, how many of us are already wearing watches that allow us to know what our heartbeat is at all times, our sleeping habits, and if we put it in, what we ate and how often we exercised. So technology exists. It just needs a little bit of tweaking. But most importantly, the big step is having people being willing to do this. Because, of course, people are going to be a little bit hesitant to have anything that would imply they're being tracked. And so it comes down to, do we want to pay less and be a little bit happier? Or do we want to continue eating unhealthy, living unhealthy, and paying for it later? There's always a price to pay. And in a reactive society, it's a big price. And the thing is, you don't see that big price until you have to pay it. But in a proactive society, you're always paying it, just at smaller increments. It's the same reason that people work out every day, the same reason that they eat healthy every day. It's a delay of satisfaction and that working toward a long-term goal of health that's not guaranteed, but can and should be rewarded. Because if you're going to make those sacrifices to in turn have less of an impact upon our pool, society should reward you. If you're being healthy, you're taking less out of our resources when you get injured. You're taking less out of our resources when you need extra assistance. It's an interesting future that we can work towards. So whether you agree or disagree, I invite you to think of your own solutions or to work with this one. Because, as always, it's the transparent competition model that we use to create a better future that makes this worth doing. To not pursue the dollar, but to pursue a greater good for all of us. Everyone, not just ourselves. Let's use our great minds, and let's use our even bigger hearts to get somewhere that helps us rather than hurting us. Because that's a future that we can all look forward to. So thank you very much for tuning in today. I wish you the best, and hope that you learned something today. See you next time.